New South Wales officials have reinstated restrictions for residents just 2 days before Christmas in a bid to slow down the spread of Omicron. Kenny Heatley has more.
We've had a big increase in cases in New South Wales over the past week, in fact rising almost 2,000 in just 24 hours up to today's figure of over 5,700. And interestingly, they said that 70% of these cases are in young people aged 10 to 39-year-olds. But some changes in the restriction settings a couple of days out from Christmas. Let's go through them for you now. So as of midnight, masks are now required in all indoor settings. So this is basically getting in line with other states and what they've done over the past few days as well. They're urging people to work from home once again. Hospitality venues from December 27, they are going back to a 1 person per 2 square metre density limit. No changes to the Ashes test capacity limit though at the stadium. They're encouraging people not to mingle over this Christmas and New Year's break. And according to the National Cabinet agreement, as what Mr Perrottet was saying, the Premier there, they're putting back in mandatory QR codes. So you'll need to check in again at retail and hospitality venues. And then what happens is you'll be alerted if you're were at a venue at the same place as a person who had COVID, and you'll get a text message with instructions about what to do. Now, 20% of tests at the moment, and there's been a big demand for testing this week. That 20% is for interstate travel requirements, and the Premier says he's been working with other states to figure out what they can do about that PCR testing requirement. But here's a bit more of what the Premier had to say about the testing and the fact that you should only get tested under certain circumstances.
What I would say is that if you have been into a setting and you have checked in, and you receive a notification from Service New South Wales that the #1 position is that you monitor for symptoms, and if you do not feel unwell, you don't need to be tested.
The Chief Health Officer, Dr Kerry Chance, said that there is some promising signs with the Omicron variant, but still need to be cautious here because there's not enough data yet that is making them definitive about the Omicron variant at the moment. But she said that 80% of the current cases that we're getting in New South Wales right now is of the Omicron variant. The rest is Delta, but Delta seems to be on the decrease. So it's probably not going to be long before Omicron takes over completely from Delta, considering that it's on the decline. Also, that Omicron is has a severity 5 times less than Delta at the moment. However, transmission with Omicron is far greater than Delta, but says that booster shots do provide a lot of protection against Omicron. That's what they're seeing at the moment in terms of the data that they're looking at. And she says it's very likely that it will also help with transmission. Here's a bit more of what the Chief Health Officer had to say.
It indicates that infection with Omicron is likely to be milder than infection with Delta, with the risk of hospitalisation being around 60 to 80% less than for Delta. But the issue is the increased transmissibility, leading to high case numbers, and the impact that this is having on vulnerable settings, vulnerable people and critical workforces.
The other thing is New South Wales government is going to make rapid antigen testing freely available to people. When that is going to happen, it's still unclear at the moment. They're still working through those details, and they're urging people to come forward and get the booster shot. And they said 65% of people in ICU at the moment are currently unvaccinated.